joined Loma Linda in 1997. Mr. Castillo currently serves as an Assistant Vice President and Risk Manager for Loma Linda University Shared Services. He is primarily responsible for the insurance procurement functions across all Loma Linda entities. He is also Vice President of University Insurance Company of Vermont, Loma Linda's single-parent captive insurance company. Mr. Castillo is a member of several professional organizations, including past president of the Inland Empire chapter of Risk and Insurance Management Society. Mr. Castillo received his bachelor degree in business administration from Pacific Union College and MBA degree from the University of Redlands. Please welcome Raul Castillo. We also have with us Chris Johnston, Associate General Counsel for Loma Linda University Adventist Health Sciences Center. Chris Johnston is an attorney licensed to practice before the Supreme Court of the State of California and the United States District Courts in California. Chris attended La Sierra University, where he graduated with a Bachelor of Arts, summa cum laude, and Pepperdine University with his law degree, magna cum laude. Mr. Johnston currently serves as Associate General Counsel for the various Loma Linda University entities, including hospitals, physician practice groups, and a health sciences university. Throughout his legal career, Mr. Johnston has devoted significant attention to advising physicians, dentists, nurses, and allied health professionals with respect to malpractice liability. Previously, Mr. Johnston provided claims and litigation management services as a risk manager. Mr. Johnston has also engaged in the private practice of law, where he has provided a full range of legal services to individual, corporate, and government clients. Please welcome Chris Johnston.
Well, good afternoon. Thank you for hanging in there all day. Nothing better than to listen to a risk and legal presentation well after lunch, late into the afternoon, when you're just ready for the end of the week and Sabbath to get here. And so we understand we are all that stands between you and the rest of Sabbath, but hopefully for this next hour, we can share some stories with each other and make our time valuable. We have some goals that we are going to talk to you about, some goals that we would like to cover as we spend some time together this afternoon. If you have questions during the presentation that you think the group would benefit from, then go ahead and ask those, and we will see if we can answer them. If it's an easy question, please direct it to me. If it's a difficult question, Mr. Castillo is ready and willing to answer any questions you have. So the goals we have that we would like to cover with you, and feel free to evaluate us as to whether or not we have covered these goals with you. In fact, you can fill out your evaluation right now. We understand that there have been a couple that have already come in. As long as they are good and you don't call us she, you can go ahead and fill them out in advance. Otherwise, you might want to spend some time listening to the presentation. We're going to talk about some of the emerging risks in international programs. Now, we understand our group here is pretty diverse, and those that are joining us via the internet are guaranteed to be from diverse different organizations. So what we're going to try to at least attempt to do is give everyone something that's useful and everyone something that's useless. That's not really on my goals because I didn't want you to grade me on how useless we are. But here's what we want you to take away from this presentation. We are really looking at travelers that travel abroad and the places that send these travelers and the places that receive them. You will notice that a number of the references we make come from a distinctly Western Hemisphere, United States perspective of sending employees abroad or volunteers abroad. Whether you have an organization in the United States or in any other country, if you receive workers or volunteers from another country, or you send your your employees or volunteers to another country, a number of these principles will apply to you. We will talk about some of the emerging risks, as I mentioned. We will also discuss how do you develop a travel program and travel policies, tearing down silos between departments, some of the problems that might exist in protecting your programs currently, and we'll spend a little bit of time on understanding legal ramifications of interactions with both the United States government outside of the United States and the governments of other countries. And then finally, and it's in your syllabus, we will talk about some of the liability and safety issues that should concern everyone when traveling to a country that you are not familiar with. And these, of course, will probably apply even while you're within your own country.
Chris, you and I, it seems like are often an afterthought when it comes to planning these international trips. The legal department, the risk management department. But our experience has been that often at the 11th hour, the things that hold things up or that seem to be an emergency always end up at one of our doors or both of our doors. So we want to kind of dispel, I think, that myth that the reason why we like to delay things or put a roadblock or a perceived roadblock is that we're trying to add additional costs. The cost of these international trips are already high enough as it is, and we don't want to add to it.
Welcome aboard. It's 2007, and we are more committed to your safety than ever. And that's why we'd like you to pay careful attention to this important safety information. First, please make sure that your seatbelt is securely fastened. Seatbelts can be purchased for $5. To fasten, insert the metal fitting into the buckle and tighten the buckle by pulling the loose end away from you. To release, purchase a release flap for $7. Now I know what you're thinking. We've never paid for seatbelts before. Once we've reached our cruising altitude, your flight attendant may or may not go down the aisle with snacks. If she chooses to, each passenger will be given a single peanut. Lavatories are located at the front and the rear of the airport. Please take a moment to look at your safety pamphlet. The charge for looking at this pamphlet is $3. The charge for looking at this pamphlet and putting it back quickly is $4. Should there be a rapid change in cabin pressure, oxygen masks will automatically drop from the compartment above your seat, free of charge. Place the mask over your nose and mouth, and to start the flow of oxygen, pay your flight attendant $75.63. As always, exact change is appreciated. Now I know that some of you are still concerned about getting there safely. Enjoy your flight.
Now, Raul, as we look at traveling, other than the expenses of even getting on an airplane, what are some of the common risks that we probably ought to think about as we travel?
According to International SOS, who's a company that provides emergency evacuation services, they provided a list, at least based on frequency, of the types of events that they have to respond to. And we don't need to dwell on any one of these, but it's interesting to see some of them are more of a nuisance, but we certainly have to plan for them and make contingency plans for them. Travel delays, everyone's experienced that. It's not the end of the world. It usually doesn't impact us financially too much. Illness, that certainly can, depending on the severity of the illness. Lost luggage, it's very traumatic for the person who lost that luggage, but again, not the end of the world. It's not going to be a catastrophic event for us. Lack of access to appropriate medical care, opportunistic crimes, petty theft of that nature, accidents, civil unrest, pandemics. A lot of those can be a lot more serious, but fall a little further down the list as far as frequency. Language, cultural barriers, remoteness of work location, political upheaval, natural disasters, travel-related infections, Lost passport can be very difficult to deal with if you're the one who lost the passport, and infectious diseases.
And of course, these common risks have been around for a long time. Some of you have firsthand experience, and you could get up here and tell your stories about how horrible this is. But something we want to leave you with is not something that you've all experienced, because most of you have traveled to even get here. So you know about these things. But Mr. Castillo fortunately has access to a number of service providers that provide travel services, and so I've asked him to communicate with them and find out what are some of the more emerging risks. What are the things that are coming back now that people might not be thinking of?
Loma Linda has an established relationship, and has for the last several years, with a company called MEDEX. MEDEX is a company that provides emergency medical evacuation as well as emergency security evacuation services. And I called them up the other day. I wanted to get a sense for what are the emerging risks you guys are seeing. They're the ones who get that emergency 911 call when they're somebody who needs medical attention, a group of students perhaps that's in a hot spot that needs evacuation because of some political unrest. What are you guys seeing? And I was actually a little bit surprised at what they came back with. Mental health issues is one thing that they mentioned. One peculiar thing that I found interesting on that is when they send emergency responses to mental health issues, they usually have to send along 2 people. And one of those persons, they recommend that be the same gender, because for the example of the game was actually bathroom facilities. If it's someone that cannot be left alone at all. So that's the mental health issues is something they're seeing a lot more of. And the one that surprised me quite a bit is the rabies. They're seeing a lot more cases of rabies. They gave an example just recently, earlier this year, May of this year. There was a situation down in the Bahamas. And my understanding is in the Bahamas that they don't have any cases of rabies. They don't have rabies there. And they had a 19-year-old student who was bit in the ankle by a dog. Unfortunately, none of the clinics had any vaccination. So they had to evacuate this poor student to Miami, the nearest place that had a prophylaxis. And that student was unable to continue on with the trip because if rabies goes untreated, it will be fatal. So they're seeing a lot more cases of rabies. They had another story of a group of students that were in India, I believe, and 5 of them were there. A group of students was playing and petting some monkeys, and 5 of them got scratched. So they go to the local clinic, and unfortunately, there are 3 vaccines available. So the other 2, they had to evacuate and get them to an area where they could receive the proper treatment. Another area they are seeing rabies cases is bat saliva of all places, presumably from trips that go into and explore caves.
So there are also security risks that we need to be concerned with. For these, I'm just going to touch on them, and a number of these slides, you'll notice that we will move through pretty quick. The reason is they're in your materials, and we believe you can read them just as well as we can read them to you. The other reason is that attorneys are kind of like gas, and if you give us a void, we will fill it. So we tend to get a little long-winded sometimes. So I promise to just move quickly, go through some of these without reading every word to you, but wanted to give you some background as to what we are trying to deal with here. Now, communication risks, both internal and external. How many of you have ever been in a position where language has been a barrier to advancing your mission? Anyone where language has been at least a challenge? A number of you, if not all of you. Well, that's certainly the case when you're developing a travel program. And one of the reasons is because just about everywhere you travel, you're either going to encounter people that speak different languages, or if you are the host country and people are coming to you, a number of them will speak other languages and may have a heavy accent that makes communication difficult. And even if you're speaking in the same language, but in different dialects or with different accents, sometimes it's just difficult to understand each other. So what we want to talk about in our communication risk is not just language barriers. We'll talk about that first, but we also want to talk about how do you communicate these risks within your organization. But for example, one of those problems is where you think you're both speaking the same language. So Raul and I both speak English when we're talking to each other. But sometimes I may be saying something, he may be hearing something else.
Das hier ist mein Sektor. Das hier ist das wichtigste Gerät des Küstenwächters. Das Gerät und das Gerät. Überlebensradar.
Mayday, Mayday. Hello, can you hear us? Can you hear us? Can you... Over. We are sinking. We are sinking.
Hello? This is the German Coast Guard.
We are sinking. We're sinking.
What are you thinking about?
So what we want to look at is kind of a team approach. How do you involve everyone you need to and communicate effectively with you, involving all the stakeholders, creating contingency plans, avoiding silos. And some of you have heard of the silo effect. That is where risk management takes care of one function, HR takes care of another function, student services takes care of another function, physical plant cares for another function, and they never communicate with each other. This happens also in international travel where one department may plan the trip, another department may plan a trip to the same place. They get there at the same time. They're from the same organization. They never knew the others were coming. That actually happens. And that, fortunately for us, is a good learning experience. When that happens, you know somebody did something wrong. And it's time to call that out. What we want to do is break down those barriers. A text I often refer to, usually out of context, but here it's probably in context, is Proverbs 15:22 that says, "Plans fail for lack of counsel, but with many advisors they succeed." Surround yourselves with people that have knowledge about the areas that should have input. So as we look at developing a team approach to a travel program, we want to talk about involving a number of different advisors, and this starts with orientation and training. Orientation of the participants, training of the leaders of the event, and then, of course, we cover a number of different areas. Substance abuse and drug abuse has too long been ignored in our orientation within Adventist populations because we want to say, well, it doesn't exist because we're Adventist. Whether that may be true, that should be true, but unfortunately, the Adventist church is not completely separated from the world, and the influence of the world still touch us here. So we need to make sure we have made our expectations clear before any trips. We understand cultural norms. There have been other presentations that talk about what is appropriate in another country, and when you are in the other country, adhering to their laws that you are now subject to as you travel. So no matter where you start, you can't go out saying, well, it's okay to do it this way in my country, and think you're okay. You may never get back to your country if that's what you're thinking.
Chris, back on training, one question we often get in our offices prior to the trip is what we need to do as far as waivers, liability waivers, releases, things of that nature. And I know from the risk management perspective, what I'm most interested in is language more to the effect that they recognize the risks that they are assuming, an assumption of risk. But as far as actually, and again, in assuming that risk, there are inherent risks that go along with a lot of these trips. Depending on the nature of the activity, some of those risks are going to be high-risk activities, but just traveling itself has some inherent risks in it. And we want the travelers to fully realize what they're getting into. But as far as waiver of liability release, what's your opinion on that, Chris?
With a waiver of liability and a release, of course, whatever document you develop to protect your institution is first only as good as the document, but also only as powerful as the laws in the place that you get sued. And that doesn't mean if you get sued in America or if you get sued in Japan or if you get sued in Rwanda. What it means is the actual venue and jurisdiction of where you get sued. So, for example, getting sued in the United States usually means getting sued in one of the many United States. And each of these things have different effects. What they're most effective at is not preventing your institution from having to defend itself in a lawsuit. What they are most effective at is managing the expectations of the person that has signed them. They may give you an affirmative defense, such as assumption of the risk, but they are not likely to be a complete bar to any lawsuit. So the reasons we use them is to inform. We're going to talk about the difference between liability and safety at the end, but sometimes we go into things thinking if we are protected ourselves from liability, we are done. We have done everything we need to do by having somebody sign something. That's not the end of the story. That's one part of it. Emergency awareness. Some of our institutions have emergencies that come up from time to time. Even here in the United States, we tend to have these things that might affect your physical plant. Sometimes you might need to relocate your patients, for example, outside of your emergency department into the parking lot. These sorts of things require pre-planning. Also, emergencies that happen when your employees or volunteers are in another country. Raul, what do you do when something happens to one of your people in another country?
Yeah, I mentioned earlier, I'll give you our experience with the relationship with the company called MedX. And the reason why we started that relationship is because it was important for us to be able to have one place to go in the event of an emergency. So if there is a trip out in the field that requires emergency medical evacuation, emergency security evacuation, there is one place to call. There are several. I'm not here to necessarily sell any particular product. There are several companies that provide this service. And the reason why we went with this company is because we wanted basically, in a nutshell, one-stop shopping. It doesn't make a whole lot of sense for in the heat of the moment, you get that call, that midnight call, it's somebody needs to be transported. Well, are they a student or is it a or is it an employee? Because depending on that, it might depend on who we need to call for those emergency services. We don't need to be dealing with that in the heat of the moment. So for us, it's been important to have kind of that one-stop shopping.
And communication, as we're talking about, is important. You need to have a plan for who's going to talk to which organizations, who speaks for your organization. A number of people believe they do. A number of people want to, and during an emergency or emergency situation, we really need to decide who it is that controls that message, who communicates with trip participants, local authorities, embassies from other countries when we have different citizens from different countries in our country, family back home, who talks to the media, who talks to the public. Those are things that need to be part of your travel program and plan. Which brings us to developing the program itself. How do you develop a program to minimize risks? We will talk to you a little bit about Loma Linda's program, which has been a long time coming, but certainly the first part of it, this seems easy, taking an inventory of your activities, those activities that are for you international, the ones you don't conduct on site. Now, certainly you need to have a risk management program for your activities on site, but that's not the topic of what we're here to share with you today. But for making a plan for when you conduct your activities abroad, you need to take an inventory of what activities will take your resources to another location. Raul, is this a pretty quick activity?
You know, I look at one of our audience members, Amanda. We've had our program in place now for 2 or 3 years. And that's a lot easier said than done, taking an inventory of your trips, depending on the size of your organization. But if you have a large organization, you have a lot of the stories that Chris described earlier, where you have different arms of the organization doing their own thing, having their own purposes behind each of those trips. We're a lot better off than we were about 2 or 3 years ago, but we still aren't quite there. So that task in and of itself of trying to quantify the trips that actually go out is very important. At least get your arms around what that exposure is.
The next step is to analyze your risks. That is, look at where you're going and what you'll be doing there and what sort of activities you will take on. Status of the host institution is somewhat vague, but look at where you're going. Are you going to serve in another hospital, another clinic, a college, a university, out in a village? Are you sending people without a definite plan? Maybe they are going to serve with an NGO that is from another country that is also in that country, and you're hoping that they have some local knowledge. Depending on the resources that host institution has, or if you are the host institution, understand what it is that you are able to provide or not provide, and what the expectations are of you, because certain risks need to be evaluated by those that are participating. Raul, speak to us a little bit about who the participants may be in these trips and why that matters.
A couple I want to focus on is minors, and we get that question a lot, where you will have a trip participant who is included in part of the trip. Maybe the spouse wants to tag along, and they have no official involvement in the trip. But let's say they have a minor child that either because they want to take them along or simply because they don't have child care options to them, available to them, then the child's coming along as well. Again, I don't know if there's any right or wrong answer. It's just an issue that you need to be aware of and be able to address when it's presented. We've taken it on a case-by-case basis. One question we certainly ask is if your child is coming along and you have any official duties on this trip, who is going to be watching your child, because that could be a liability there with that accompanying child. But also, are you going to be able to fulfill those duties that you're coming along on the trip for, if you're bringing the child along and caring for that child?
And Raul mentioned how sometimes some of these things stop at our desks, and I am one of the ones that says, no children. No children, no minors, go on trips. If you want to take a family vacation, take a family vacation. I think everyone should take family vacations. However, my rigid stand is just something people tend to work around, so I have to think of other ways to minimize the risk. So I usually say, well, talk to Raul. If he'll say it's okay, then I will say, I guess. The point is, what is the mission, what is the purpose of your trip, and are the people that you are taking there to provide that service, or are they there to provide a vacation for that family, which could be wonderful. Now, that's not to say that long-term missionaries that are spending years in another country should do it solo, should leave their kids behind. But it is to say, let's think about the location that people are traveling from their own country with their small children to another country, and is that the appropriate environment for them to be as we manage those resources, or would there be another opportunity that would be better for them? Chris,
another question that we get a lot relates to activities unrelated to the sponsored trip, and that is a real gray area. I wish there was just a simple yes or no I could give you, because that's anywhere from the group is there over a weekend, and what else are they going to do? Perhaps the official activities, there might be something through Sabbath, but maybe Sunday they have free. It's anywhere from that to, at the end of the trip, I want to tack on a 2-week extended trip of my own. And I think there is where it gets a little easier for us to say, your official involvement with our particular trip ends right here. Anything you do after that. And again, back to the assumption of risk issues that we talked about earlier, for us, it's important for them to acknowledge the fact that they are aware of what that distinction is.
We also consider a number of other items. Something I call risk appetite. It's probably not the best phrase to think of, but that is, some institutions say, we just are going to forego this trip because it is too risky. So as you're developing your plan, you have to understand what it is, what risks are you willing to tolerate? Are you willing to tolerate sending certain individuals to certain countries? Are you going to tolerate anything that anyone requests? Are you going to only allow trips that go through a certain approval process or have specifically board approval, those sorts of things, understanding what insurance might be required and what the decision-making process is. And when I come to an insurance question, I have it easy. Some of you don't have it as good as me. All I have to do is pick up the phone and call Raul and say, what do I do? And he can explain the insurance coverages.
I want to talk a little bit about the insurance ramifications. Next slide. And the only thing I want to say there is insurance should not be driving these decisions. Insurance is really there as a backstop if something goes wrong. Really, our focus should be on the safety and appropriate planning for these particular trips. But if something does go wrong, we should do our homework and have this in place. I just want to mention a few of the potential coverages that might be impacted when we do send trips abroad. General liability, professional liability, workers' compensation for our employees, health coverage could come into play. We talked some earlier about evacuation, repatriation. Property insurance, once in a while, we might be taking fairly expensive equipment with us, depending on the type of trip it is. There could be some expensive camera or other type of lab equipment that we might be taking that belongs to us that we intend to bring back with us. It's important to check the territorial limitations to make sure that that coverage will still follow you when you are going to your destination. Auto liability, occasionally we do rent vehicles overseas, and trip cancellation.
So Raul, when we have, say, employees and volunteers, different people go on different trips, or they may all go, people of all these categories might go on the same trip. What's the analysis you, as the risk manager for Loma Linda University, would take us through if these individuals were going on that trip with all these insurance coverages available?
You know, what we did several years ago is kind of take an inventory of our existing programs. Chris mentioned earlier about the silo effect, where certain departments might be handling certain coverages, other departments might be handling others. And first, let's take an inventory, see what programs we have, make sure we don't duplicate our efforts. And what we did is kind of divide our potential travelers into three categories. First of which is our employees. Obviously, in a university setting, students is another component, and volunteers. We'll start with workers' compensation. We do have that coverage already in place, at least for Loma Linda. And this is not necessarily going to apply to every institution. You'll have to go through this analysis for each of your entities. But for Loma Linda, this is what it looked like. For employees, workers' compensation, yes. It doesn't apply to students. It doesn't apply to volunteers. Health plan coverage. We have coverage for our employees. We have the same type of coverage for our students, and that coverage does apply internationally, but none available for volunteers. Professional and general liability. Yes for employees, yes for students, potentially yes for volunteers, depending on the facts and circumstances. Evacuation, repatriation. Yes for employees. Yes for students, and none existing for the volunteers. Personal effects, again, it's not going to be catastrophic. It's not the end of the world, but it certainly is a nuisance. And as an institution administrator, you have to, do you want to deal with the inconvenience of travelers coming back and wanting payment for the luggage that they lost on your trip? None available for the employees, students, or volunteers. Auto liability, yes, yes, no. Trip cancellation, none of the above.
So this is the analysis we go through as an institution. This slide isn't in your materials for a very specific reason, because this only applies to us. You have to do this same analysis for your own organization. Talk to your insurance company. Talk to Adventist Risk Management. Neither of us work for or speak for Adventist Risk Management here today. So you need to make sure that you have communicated with them or whoever it is that is insuring you, so you can go through this same analysis. Now, as you review your policy, that policy that governs your travel program, first thing you have to ask is, do I even have one? It sounds like a silly question, but before you start writing a travel policy, Make sure there isn't one that already exists that you just need to update or change. Find out whether it's enforced and whether it's enforceable. If you just make this one more large bureaucratic process that people are going to avoid, you have accomplished nothing. You've only made the problem worse. And of utmost importance in any travel policy is figuring out what your institution's approval process will be. Understand the ethics of international travel. Since all of you are here with us today, you're missing the presentation on bioethics, international bioethics, but you can watch it later online. It's certainly a consideration you need to cover within your policy, and of course, who approves. Once you've got that travel policy worked out, you need to implement it. Work through the implementation of the process, whether it involves purchasing software, getting the buy-in of the appropriate department. Certainly board approval is important, imperative, and their support. Participant agreement in the travel program is also of utmost importance. But the most important thing, at least from a risk and legal perspective, is the approval process. Having key decision makers involved in the approval process, having the appropriate departments, administration, finance, risk management, human resources, all understanding what the appropriate travel is, how it complies with the policy, and what should be done to approve a policy.
Chris, since we're relatively new to this too, like Chris mentioned earlier, anytime you try to establish some administrative process like this, expect some pushback. It's going to be seen as a little bit of red tape, as a barrier, a roadblock to get the participant, they want to get their trip planned, and they've done this before. Let's get going. One thing that we found helpful is there are certain departments you'll notice that have a good chunk of those trips. Involve them in the process. Get them involved in this committee that Chris was recommending. We found that extremely helpful. And that way you bridge some of those silos that we talked about earlier.
It's amazing when you have people. There are committees that actually do some good. And this doesn't just mean a committee within a department to help that department work through its issues. But this committee should have representation that's across departments. So it does a couple things. First, it lets you know what other people are doing, but it also gets multiple departments to buy into the process.
I think over time, much of our camp is now starting to see that as a resource instead of a hurdle.
One of the interesting things about legal and governmental impact is that more and more, both U.S. organizations, European organizations, and as well as entities in other countries, are looking to government entities to help fund their projects in other countries. ADRA, for example, has quite a bit of government funding. But there are always, lawyers don't like to say always, but this time I will do it. There are always strings attached to government funding. So the government support might seem like a good thing, and it may in fact be a good thing. But it's not always. There are oftentimes that the contract that you enter into with the government has certain restrictions. And I'm going to run through these pretty quick, but I want to end with some advice that will hopefully get you out of trouble and keep your administrators out of jail. Has there been appropriate contract review? One clause that is often buried in a 150-page contract is that you will not discriminate in employment based on religion. That is something that both U.S. and other governments are starting to put in their contracts. If you are the Adventist church or an arm of the Adventist church, you likely do discriminate based on religion. Are you going to now sign a contract saying you will not do that? Any contract I review that says that becomes a deal breaker. An easy way around it is usually to say, I will not unlawfully or illegally discriminate. So because there is legal discrimination. We have hiring preferences within the Adventist church. We don't have to hire Catholic priests to be our pastors. We can actually choose Adventists to be our pastors in our church. That's important. Let's not contract that sort of thing away. Will the contract subject you to governmental audits? We recently went through a government audit here by the Office of Federal Contract Compliance Programs, or we like to call them a lot of things, but one thing that we're supposed to call them is OFCCP, just because they have a name that's too long. But one of the reasons they came to audit us was they wanted to, but they had to start with a contract that allowed them to do that. And the contract that allowed them to do that was a really insignificant contract to us. In fact, the work we had to do, the expense we had to go through to comply with the government audit exceeded the value of that contract by about tenfold. So pay attention to what these contracts are. They have strings attached. And then what I wanted, this is in your materials, so I'm going to go through it quick. A number of these contracts will say you must comply with the Defense Base Act of 1941. That is when the U.S. government is paying for something. And the Defense Base Act is a U.S. law that only applies to activities that are not in the United States or Guam. It started out in 1941 as only applying to U.S. bases, but the act was amended in 1942, 1953, 1958, and so by now, this law actually covers government projects that occur anywhere. It doesn't have to be on a base, and it's usually public works projects. So if you want that government money to help you come build a new road to your campus, put in new generators for your hospital, decent chance that the Defense Base Act is going to apply. And the Defense Base Act basically extended the Longshore Harbor and Workers' Compensation Act, which was this is probably too much information for many of you, so I'm going to go fast. Basically a workers' compensation program for harbor workers. That means any job-related injury, you had to provide coverage. So the DBA required coverage for a number of things and a number of benefits. Here's the list of benefits. You have this in your materials. But you can understand these are not benefits that are required in every country. But if you accept U.S. government funding for that contract, you may now have to provide even your in-country workers. These aren't U.S. citizens. These are anyone who's working on that project. This coverage. Compensation for partial loss of earnings. If they're totally disabled, 2/3 of the employee's average weekly rate. That's probably not good if this was only going to be a 3-month project and now you're going to be paying those local workers for a long time. Death benefits, permanent total disability benefits. And so you're probably saying this seems like it doesn't, it's just too much to think about. Does it even matter? Well, yes, it does matter. It's the law, at least in the United States, and that's important because the damages here are much greater. But the penalties are important. One of my jobs, I believe, as an attorney for this institution is to make sure we do things at least to a point that keep Dr. Hart from going to jail. And this is one of those things where if we get it wrong, the president, the secretary, or the treasurer of the corporation defendant could end up in jail. So it's worth getting right. And so if you are in another country, for example, and you have an organization that comes to you and says, I got this excellent USAID contract. We're going to come, and not only that, we're going to hire all of your students and put them to work. And when we put them to work, we're going to pay for their tuition. They're only going to have to work for 3 months, but that will pay for their tuition for the entire year. They're going to build this road under this contract. And something goes wrong, and we don't have this coverage, and we end up with a lawsuit in federal court in the United States. And guess what? It sounded good when we started it, but it's probably not good. It's not good for me when Dr. Hart goes to jail or pays the fine, although the fine, we could probably handle the fine a little better. I might even survive that part. But the arrest warrants are not good, even though I think It costs about $44,000 to house a prisoner in the United States, so they're taken care of. But it's still not a popular place to be. So, before I move on to the next line, I just create the problems. Raul's the solution man. So, Raul, DBA compliance sounds like a headache. Somebody wants to come to our organization. They know they have to comply with it. I remember I went to a conference there in Loma Linda. They said DBA is bad. I don't remember why it's bad. Now what? What's the solution? You have 30 seconds to fix it.
Talk about little things that can get you into some big trouble. We don't do much of this. We don't have a lot of contracts overseas with the government. USAID contracts, USAID subcontracts. In fact, years ago, I was sitting in a conference very much like this. I thought we had things under control. We had an insurance policy that covered our international workers' compensation exposures. We're covered when we send these people overseas. And when I learned about this DBA, there was a little bullet point that Chris mentioned earlier about the imprisonment, and I noticed that it was required. I came back home and remembered hearing something about a USAID sub-agreement that we had. We've had a couple of them over the years. And when I came back and showed this to our administration, when they saw that bullet point about one of the penalties possibly being imprisonment, as far as whether we were going to purchase it or not, they were all in. There's no question whatsoever.
It's the easiest way to sell insurance. Buy this, no problems. Don't buy it, you could just go to jail.
Again, I think the church in general is not going to have very many contracts with the government. Where we do occasionally get involved is some of these USAID agreements directly or as a subcontractor of a USAID agreement. And the problem is even if we happen to be a subcontractor, the requirement is incumbent on us as the employer. I don't care if they forgot to leave it out of the contract. The requirement is with the employer. So it's our employees that are going over, and that's who's going to be subject to those fines and penalties that we just discussed.
And beyond the DBA, there are, of course, a number of other legal issues while abroad. Any changes in your family status? Getting married? Now we have an issue about citizenship and an issue of emigration and immigration as to whether or not you can bring your spouse home with you, or whether or not you can stay in the country you got married in with your spouse. Birth of children. The story told, some of you were there this morning, about our nursing program and their graduate nursing, the Loma Linda graduate nursing program in Thailand. One of their students showed up from Haiti for the program, believed she was less pregnant than she was, that she probably had a good window of time to get back to Haiti and did not. Had her baby there in Thailand. Well, unlike the U.S. where you have automatic naturalization to children born here, that's not the case in Thailand. And so they had to get a declaration of citizenship from Haiti in order to give the child status, because the child had no status in Thailand and no status yet in Haiti. And the options were, mom now is on a visa, needs to return. You can return, but if you return, you have to leave your baby in an orphanage. Or you can find a way to stay with your baby. Well, it took about 6 weeks to sort that out. And the baby did get to go home. Dad finally, 6 weeks later, got to meet the baby. But these sorts of things happen. Employment laws. Very important because this changes. I was working through an issue in Palestine recently, and the labor laws that benefit the employees in Palestine, a number of places, are going to keep your administrators pretty busy all the time. So you can't assume that if you move to another location that the laws that govern you where you came from are going to be even similar to the laws, the employment laws where you go. Tax issues, income tax, even for missionaries, have created a number of issues. Local taxes, sales tax, all kinds of tax issues can be issues to think about while abroad. We're going to get to our last section here because we only have a few minutes left. What we've given you in your packet there, in your syllabus, is a list of a number of safety precautions that we recommend and I'm going to just be honest with you. Sir Anatole France once said, when something has been said and said well, have no scruple, take it and copy it. So what you're going to see here is something that I have copied from the U.S. Department of State's website. It's at least the things that I thought were important. So you can Google these and find these yourselves, or you have them there in your packet. They're going to be our travel and safety issues. But before we do that, I want to talk about liability. I mentioned this briefly before, the difference between liability and safety. Liability just means responsibility for the most part, or culpability. That is what you can be blamed for. So in this instance, what we are really talking about is protecting your institution from a lawsuit. And if the discussion in your travel planning only gets to how do we protect our institution from liability, you have taken the wrong approach. The risk management, now this is coming from risk managers and lawyers telling you going towards liability is taking the wrong approach. And the reason I say that is, if you look at safety, take the approach of keeping your people and your institution safe. Liability protection will follow. We can cover a number of things by insurance. We can do things by contract. But look at safety first. One of the things that we are often asked is whether an altruistic motive insures against risk of loss. That is, we're going somewhere to do something really good. How could anything bad ever happen to us? They're not going to sue us because we're doing something good. We're building something. We're caring for the sick. We're doing something good. We have enough experience in this to tell you that that's not true. Altruistic motives do not insure against the risk of loss. So we're going to take you through, Raul, if you could take us through this first one, safety issues. Raul's getting ready to go to Europe, one of the pickpocket capitals of the world, and see if he can implement some of the things we're going to tell you, and we'll ask him in a couple weeks when he gets back whether or not he got robbed, and you have to come back to the next conference to find out the answer.
The fact is, most of you could probably teach us a thing or two about these particular topics. Since we are running a little bit low on time, on your way out, I do want to mention there are 3 handouts if you are interested. One of them is a pre-travel checklist. Certainly not every single one of those items would be necessary on your trip, but just kind of jog your memory on some items. There is a document on medical preparedness for international travel, as well as security precautions and preparedness. So 3 of those documents available here.
And they're on the front row here, so if you didn't get them, there's plenty. If you want to take an extra one for a friend or a spouse, they're right here on the front row, so go ahead and grab them. But here's...
Chris, since we have about 5 minutes left, we may want to open it up for questions.
Yeah.
See if
I'm going to just go through what is here, and if you have any questions, be thinking of them. We have street safety. Here's the issues that you want to keep in mind. Hotel safety, if you're staying at a hotel, keep these points in mind. Transportation safety, actual sign. I think this one's in Arizona.
I believe so.
Do not pick up hitchhikers next to prison facilities. Kind of thing you would think you wouldn't need a sign for. There's only a sign there because somebody did it. So don't pick up hitchhikers during near prison facilities. Driving safety and carjackings are real, not just in Southern California, but in many countries. Keeping your money safe. And finally, document safety.
Anybody lost their passport overseas?
So, at least a couple. It's no fun. That's a good way to ruin your trip, or at least that segment of your trip.
You want to know where the nearest consulate is. In many countries, that's the only way to get a replacement. Find out where that is before you go.
Something I always do with my passport is leaving a copy somewhere at home so that I can at least get that copy sent to the nearest consulate or embassy to start that process. That has just made it easier to do it. So far, I haven't lost my passport. Also, if you're traveling with a group of people, like 100 people, and you're all from the same country and you all have the same looking passports, I get a label maker and I put my name on the front of my passport or the back of your passport if you're worried that you're defacing a government document. I don't care. I put it on the front of it. No one's complained yet. So the front of my passport has a big white label that says Chris Johnston. Just so when I'm moving it around, I know that one's mine. And I see a lot of other people's passport, and I think apparently it must not be a problem with people grabbing other people's passports, because I'm the only one I know that does that. But there's my...
Another recommendation I've heard is to email a copy to yourself. If everything gets stolen, chances are you might at some point be able to get some access to some free internet. And once you get online, if you can get access to your own account, you can at least get a copy of that passport and get you further on down the road than you otherwise would have been.
So, of course, as we started out, we're not here to be the roadblocks, although we sometimes are, but we understand that without risk, there's no reward. So that's why, although sometimes our answer is absolutely not, don't do it, our answer is usually, let's find a way to do that, but possibly minimize the risks. We can take some questions now. Well, we can't take that many questions. But, let's go right here first.
Yeah, you were talking about government contracts. It sounded like if you have one or two government contracts in your organization, it's a little door that the government can get into and start auditing and examining all sorts of things, maybe unrelated to that contract. Is that true or not?
That is true. It only takes one contract to give the government reason to audit your entire operation. So you want to make sure that contract approval, this is another lecture, contract approvals at a level of the organization where people can make those kind of mistakes. CEO, CFO, somewhere up there. Yes? Yeah, so the question is, if we are reimbursed by another organization, subcontractors count as well. So subcontracts can flow up into the DBA. So yes, you do need to know whether you are operating even as a subcontractor under a federal contract, U.S. federal contract. Yes, back here. Yeah. That's an excellent question. When you have people coming from all different locations, or even locally coming into work in your hospital or clinic, what I recommend you do, and Raul I'm sure would too, is develop your protocol of what insurance is required before somebody can come and practice in your location, and then require them to prove that insurance to you. So somebody has to audit it. It might be the CFO, but certainly within their office, to tell you what insurances we require you to have to cover you. It might not be to cover our organization. We might have our own liability coverage. So, for example, here, we have a lot of doctors that practice in the medical center. The medical center has a policy that protects it. But if a doctor from the community is going to treat patients in our hospital, we don't let him come in. We don't give him staff privileges unless he shows us that he has professional liability coverage with appropriate limits before we let him in. Thank you for your...
We've added that specific component to our pre-trip analysis so that at least everyone goes into it with their eyes wide open. The last thing you want is after the fact when something happens, I thought you were covering it. No, I thought you were covering it. Then it really falls through the cracks.
We'll stand by for a couple minutes, but I think our camera time is off. Amanda, thank you.